All right, we're at ASAP's 2018. I'm joined by Dr. Lickstein. Today he's going to talk about something that's really important to him and near and dear to his heart, which is breast implant revision, also known as explantation, also known as breast implant removal.
Correct.
Cool, I got it.
You got it right in the first shot.
Yeah.
So people change, their bodies change, they age, and plastic surgeons are seeing more and more that women are coming into our offices, the implants that they might have been placed when they were in their 20s maybe were too large or their bodies changed. Some just don't want to be that heavy anymore. So more and more plastic surgeons are seeing women who either want to have their implants removed, sometimes even for health concerns, or want a smaller size, even with a lift.
Okay, interesting. So tell me about the process of actually going through that.
The first step of the process is really to understand what the goals are and what a patient may want to achieve. Most of the time people understand if I'm too big, I'm too small, and what they want to get to. But sometimes people think they don't want the implant in, and a lot of our time is spent really listening and then evaluating whether the goal can be achieved with just a smaller implant, and a lot of times you do need a smaller implant still, or removing the implants altogether.
Okay.
Many women find that gravity, it's one of the things that keeps us busy, causes the breast to sag and the tissue to stretch out, especially after pregnancies. So a lot of women still need a lift, even if they're going to keep an implant or not.
Okay, cool. So for the patients that do want to have a breast implant removal, what should they do? What's their first step?
I think the first step is always find a board-certified plastic surgeon, but the other one is to really ask questions about having experience. Do you do these types of cases frequently? What have you done in these situations? And really, for me, it's finding the right fit and a level of comfort so that any questions you may have along the way are going to get answered, any concerns you have, that you can really feel okay expressing them to the doctor, and that there's a dialogue back and forth.
Okay, cool. So what about patients that obviously want to have their breast removed, but they may be worried about, they've already had the procedure, what kind of risks or scarring maybe potentially from the removal, or is there none?
For simple implant removal, there's usually no new scarring and not a lot of pain associated.
Okay.
I think where new scars may come in is the need for a breast lift, because in a lift, we're reducing the amount of skin or the size of the breast, and to reshape it, there are incisions that are necessary that result in new scars. So it's important to understand them beforehand.